Hello. We are now going to look at how a woman's cycle is affected by the approaching menopause, and we call this in NFB terms a special circumstance. There are basically three special circumstances, and the rules are very similar for all of them. They are the post-pill, postpartum, and premenopause. As I've said, the rules are similar, but the outcomes are very different. In the post-pill and postpartum, the woman is younger and her fertility will eventually return to full strength. In the premenopause, the woman is older and her fertility is naturally fading away. We know exactly when the postpartum and the post-pill rules start because the woman has the baby or she stops a packet of pills, but we're not always sure when the premenopause rules start, as I'll explain. What exactly is menopause? Well, menopause is really the stopping of the menstruation when fertility ceases. But it can only be defined in retrospect. And you never know which is your last period until a year or two later. When nothing else has happened since then, you begin to say, oh, well, right, that was it. But you don't know at the time. However, in common usage, the word menopause, we often say she's going through the menopause. What we're actually talking about is we're talking about the premenopause, the perimenopause, and the postmenopause. So we do, in ordinary language, use this term quite loosely. But remember, it does actually mean the final stopping, the last period, in other words. So when is a woman postmenopause then? When she hasn't had a period for 2 years, if she's under 50, and if she's over 50, she only has to wait for 1 year. Menopause commonly occurs between the ages of 45 and 55 in Western Europe, but it occurs about 2 years earlier in smokers. Artificial menopause, of course, can occur at any age, and some of the causes can be radiation of the ovaries, chemotherapy, surgical removal of the ovaries, but we're not looking at those cases here. I spoke earlier about not knowing exactly when the effects of menopause actually start, and the reason is that there can be many false starts. Because I find that, from my own experience of dealing with NFB in the older woman, that as soon as a woman is in the late 40s or mid 40s, any disturbance to her cycle is usually blamed on the change. People will say, oh, it's the change. Yet her stresses in the 40 plus years can be very varied and considerable and can cause irregular cycles all on their own. You've already in the course looked at stress cycles, so imagine the effects of this lot below. Children growing up, leaving home, going to college. Parents worry about their failing exams as much as the students do. Children getting married or not getting married, cohabiting. Pregnancy, you might have a daughter becoming a single mum. These stressful situations can all impact upon the woman's fertility. I have to emphasize that the man, the husband, is obviously affected by all of this, but he doesn't have a cycle in which it can manifest itself. So this is the problem, that both of them can carry these emotional situations, but it does impact upon the woman's fertility and possibly her experience of menopause. Carrying on with that list, parents can become ill and you can have constant hospital visits, sometimes at opposite ends of the country. This is very stressful. One of the parents may die and the widowed parent comes to live, causing domestic upheaval, as we all know. Then I've seen cases where a woman's children, having left home, she went back to work, and the stress of having a new job changed her cycle completely. Others who were already working, they may get promotion, which adds to the stress in their lives, or they may not get promotion, which causes another stress. Then something we all face, but certainly as one gets older, unemployment, redundancy, retirement, voluntary or forced, and ill health. The list is actually endless. So let me give you just one example of how this sort of stress can affect you. A friend of mine, also an NFB client, let's call her Mary for simplicity. At the age of 46, she suddenly said to me, I think I'm going through the change. My cycles are going haywire. We had a look at them and they were going haywire. She had a 40-day cycle followed by a 19-day cycle. She said she was beginning to feel as if she had hot flushes and night sweats and all sorts of things like this. Then suddenly her married daughter had her baby and all Mary's symptoms suddenly disappeared, and we had a good laugh. We realised that this so-called menopause was in fact stress related to her feelings about her daughter having this baby. I have to add that Mary had 5 children of her own that she never batted an eyelid with, but this eldest and first daughter having her baby caused her more stress than any of her 5 pregnancies put together. So I use this as a funny anecdote to show you how all these situations that you think you are coping with, but the internalization of the stress can have all these effects upon cycles. And Mary, in fact, didn't menopause until 4 years later at the age of 50. But do you see how she was being hurtled into the menopause because her cycles had gone haywire? Right, so looking at the next slide, as I said, I've seen many examples. I could speak for an hour just on this, about the false starts to the menopause with clients. And you might have this. You'll have a client ringing you up saying, do you think this is the change? So that's why this slide is very important. You only introduce her to the new menopause rules or the special circumstances rules after having discussed all the other possible causal factors in her life. So the first question to ask her is saying, is there anything else happening in your life that could explain this? That question doesn't seem to be asked enough. And then you'd ask her, are there any other signs? But you have to be careful, because my friend was getting hot flushes and all sorts of things, imagining them. But when the woman herself, after you've talked her through all the potential stresses, when she eventually begins to feel, yes, I think this really is the menopause, only then do you introduce her to the new rules. And these are some of the, there's many more of these, but this is the usual list that they give. Again, speaking personally, out of that first list, the only ones I actually experienced was number 6, breast tenderness erratically, and changes to my cycle. Yes, my menopause was quite interesting in as much as at the age of 52, I suddenly had a 4-month cycle, then an 8-month cycle, and then a 28-day cycle, and I finished in a flourish and never had another one. So it was basically only 3 cycles, one of 4 months, one of 8 months, and 28 days. And looking at the second list, I would just say personally again, number 12, 13, and 14, the thinning hair, etc., for me personally, those only started appearing when I was over 65. I'm now 72, but so I don't think those are really early menopause symptoms. That's my feeling anyway, from my personal experience. Now, what causes the menopause? Well, this is not fully understood. It's not because she's run out of eggs, although she certainly has much fewer of them. But what starts happening is that the ovaries fail to respond to the signals from the pituitary like they used to in the old days. And this happens at a given time for each individual woman. So I had a friend who menopaused at 43 and I menopaused at 53. Now, why such a difference? It's inexplicable. So what we suddenly find is that the pituitary sends the FSH signal and the ovaries don't respond. So the levels of FSH get higher and higher and higher, and still very little, if any, response from the ovaries. Eventually you might get several follicles ripening, but each of them gives such a poor release of estrogen. But this estrogen is enough to trigger a little bit of mucus, but not enough to trigger the LH surge, which is going to cause ovulation. And so the result is you can have very long cycles with delayed ovulation, or no ovulation occurring at all. This happened to me for 8 months. Eventually you may get an ovulation, and then several things can happen. The luteal phase may collapse after only a few days, and it can end in a light period or an average period, or the exact opposite, a very heavy period. Or she may have a completely normal luteal phase, as I did. Or there may be prolonged spotting or bleeding, eventually going into a cycle, into a menstruation, with early shedding of the endometrium before a period. So it really is a case of anything goes almost. Now the effects on the cycles, I've already said some of this, so it's revision. The cycles, as we've seen, because of this interaction between the FSH, or the lack of interaction, let's say, between the FSH and the ovaries, the cycles can be short with an early ovulation, or they can be unduly long with a delayed ovulation, and some will end in a bleed with no ovulation at all. Sometimes the follicle grows to maturity but doesn't actually rupture, and the egg remains trapped inside. Now this is called Luff syndrome, the luteinizing of the unruptured follicle, LUF. And remember, this is also found in subfertility cases where the cycle looks completely normal. The interesting thing is that they get a temperature rise. It's not always a very high one, but they do get a temperature rise because enough progesterone seeps out from the base of the follicle to raise the temperature, but the follicle never actually ruptured. So of course there's no chance of pregnancy in the subfertility cases. And then some people will have a cycle, but it will have a very short collapsed luteal phase, indicating that even when it got released, the follicle was of very poor quality. Changed bleeding patterns, as we've already mentioned, the periods can be heavier or lighter. They can last longer with spotting for several days before and after. In fact, this can be really irritating for the women who experience it. I've had people who said to me, I seem to be bleeding all the time. Because for some the bleeding and spotting just goes on and on. For some, it's the exact opposite. Their periods shorten and they say, I hardly have anything. So you see how different people's experience can be of the menopause. Oh, sorry, we're using menopause loosely, the premenopause it is actually. So very commonly too, particularly in the long delayed cycles, bleeding, spotting can occur around ovulation, and you'll see this gives rise to a rule later about bleeding always being treated as a fertile symptom because they often bleed during a late ovulation. One very important point is if the bleeding occurs only after intercourse, and it's definitely related to intercourse and not to the actual premenopause situation, this needs investigation. It must not be regarded as normal. So you see, when a woman complains about episodes of bleeding, you must check with her what it's actually related to, okay? Now, the mucus can be, like we've already said, so many differences, non-existent, with dryness to the point of discomfort during intercourse, in which case a bit of vaginal lubricant like KY jelly can be very useful to facilitate intercourse. For others, it's constant and scant, but patchy and inconclusive. It's not going anywhere or doing anything. Or, most annoyingly, she can be wet for ages and ages and ages, wondering if she's really highly fertile, but she doesn't see anything, and no ovulation occurs either at the end of it. And she can even have a raw egg white type mucus, which may last for a week or more without ovulation at the end of it. That happened to me in my 8-month cycle. I had a month of egg white. I was now 52, and I was thinking, well, there's life in the old girl yet. I'm going to ovulate. I did ovulate, and then 2 weeks later I had a period, followed by, as I say, that classic 28-day cycle, and that was my menopause, my last period. So, as I've said earlier, anything goes. The temperature. Obviously, if she's not ovulating for weeks, for months, it'll just fluctuate inconclusively for months. So in fact, we don't take the temperature every day. That would be real torture all through the menopause. But you do start it as soon as you have any mucus patches, because it will only rise when ovulation has actually occurred. But the rise after ovulation may not be as high as it used to be, and for the woman who is very dependent on her thermometer, and I have had clients in this situation, they can get very worried about this, but it's not very high. Do you think I've ovulated? And you have to really teach them to apply the rule that as long as there's the 0.2 shift, etc. But when they've been used to very high rises, it can be a little make them feel a little bit insecure when it only goes up a little bit. The cervix. Well, at first it may not be quite so helpful because that little bit of estrogen that's coming out of these several follicles and creating that little bit of mucus we spoke about, it'll also affect the cervix. So the cervix may for a while be inclusively soft and open for a long time. So it may not be helpful to everyone, but certainly later, as the menopause really sets in and the cycles become much longer, it can become very helpful because it stays firm and low. And I must admit, in my long 8-month cycle, I found it very, very conclusive. Breast tenderness. Now, this is an important thing that you have to teach an older woman, that that breast tenderness can occur at any time now in the cycle, pre-ovulation as well as post, because you remember in the normal cycles of the younger woman, it was always yet another sign that she was in the post-ovulation phase. But that rule has to be unlearned in the menopause, so it can come at any time in the cycle. It must no longer be taken as a sign of post-ovulation, okay? And for some women, it can become quite pronounced and uncomfortable for a while in the menopause years. Now, when a client who's getting older rings you up and says, oh, well, tell me what the menopause will be like, you really have to say, I can't tell you what your menopause will be like, because no one knows what happens to the individual woman, and I've shown you enough variety for you to see. But in hindsight, it will fall into a pattern shared by many women. So there are sort of groups, as it were, as you can see. It's very good for the woman to know at what age her mother reached the menopause, because there can be familial patterns. History doesn't always repeat itself, but it does sometimes. So it's just useful to have an idea of when her mother menopaused. Really, you have to reassure the woman, sorry, and say, you need to remember that the body is moving, sometimes reluctantly, grudgingly, to a different phase in her life, and she must be patient. She mustn't expect it all to be settled instantly. You hear them often saying, oh, if only it would get over quickly, but that's not how we're made. It's going to take time for many women. So the general advice to them is, keep calm, keep fit, eat well and sensibly, and try to control your reaction to stress situations so that we can isolate the stress situations from what is actually a premenopausal situation. And then the change may not seem to be much of a change at all, apart from the ending of the reproductive phase. In some cultures, Africa particularly, the postmenopause is regarded as an empowering phase in a woman's life, freeing her from childbearing to take on different roles. So when we're teaching NFP, when we've come to the conclusion that this woman really is in the premenopause years and needs to learn the new rules, the first thing we have to do is to emphasize that there's a need for a psychological change. The woman must now start looking for infertile days rather than focusing on ovulation like she did when she was younger, because the ovulations will become less frequent and will eventually stop completely. So there's no point in looking for them all the time. She has to recognize genuinely infertile days and be confident enough to use them. That's the hard part for some. So the new rule is look for infertility, not for fertility, because you may never be fertile again. So as she begins to chart long cycles, she asks herself at the end of each day, do I consider this day a fertile or a non-fertile day? And she marks that on her chart in her own little way. She may not have the confidence initially to use this infertile day, to have intercourse on it, because she may still be very uncertain. But as the time goes on, she'll see in hindsight that she was right, because no ovulation occurred. And so she'll say, I was right, so her confidence will grow. Good charting boosts confidence. It really helps her make decisions, and she'll soon begin to understand what's happening in her body if she charts everything carefully and stores it so she can look back at it. And then she'll gradually begin to trust her judgment, and she will relax, which is critical for the success of NFP. Now, how do you recognize these infertile days? Well, there's two statements which are important. A fertile situation is a moving, fluctuating one. Things are happening all the time. A static, unchanging symptom, whatever it is, day after day after day, is infertile. Eventually, static dryness and the total absence of mucus will eventually become the norm. It'll be predominant, and that is the standard infertility. But remember, fertility is fluctuating symptom. Infertility is a static, unchanging symptom. So the special circumstances rules. First of all, she's got to establish her basic infertile pattern. We quickly call it BIP, BIP. Now, ideally, eventually, the BIP will be dryness. Now, if she's dry, she only needs to observe 4 days of dryness to know that she's in an infertile phase. However, if she's got this constant, unchanging mucus, let's say it's white, scant, and creamy, and it goes on for days and days and days. Once she's had it for 14 days, That's a static situation, and that becomes her BIP, a basic infertile pattern. And for both of them now, the one who's got the dryness that she only had to observe for 4 days and the unchanging mucus that had to be observed for 14 days, both these women can now resume intercourse, but on non-consecutive nights, remember, so that they can observe any change that there might be to any mucus in between. And they can continue like this for months and months and months until the next change. So any mucus that appears different from the BIP must be regarded as potentially fertile, even if it doesn't look like a raw egg white or anything. The fact that there's more of it, it's more stretchy, whatever, that is a change from the BIP. And the last day of that patch of mucus must be treated as a peak symptom, even though it doesn't look like one like it used to look like in the old days, regardless of quality or quantity. And then, if there's then two rules must be checked. If there was a temperature rise after that little patch of mucus, then she uses standard post-ovulation rules, and there are no restrictions on intercourse. She's ovulated and she can now have consecutive nights intercourse as desired because the temperature rise has proved it. If, however, there was no temperature rise, then she is still in the pre-ovulatory phase, so she's back onto non-consecutive nights, but only after she's counted peak plus 4 days, not peak plus 3, because there's no double check. She's using single index rule, so it's an extra count. So it's peak plus 4, and if she's back to her BIP, her basic infertile pattern, then they continue with the non-consecutive night rule. Another special circumstances rule is, and I implied this a little bit earlier, that all bleeding must be regarded as potentially fertile and treated as a peak. Because do you remember I said earlier that when ovulation is really delayed in a long cycle, women often bleed during that ovulation. It may just be spotting for a day or two, but for others it might be a frank bleed. So when there's this patch of bleeding, there's abstinence during the bleeding, and if there's no thermal shift, then she's still in the non-consecutive night rule. She must treat it as if it was a peak, count peak plus 4 days because there's no temperature rise, and then continue with that non-consecutive night rule till the next change. If the thermal shift occurs, she says, hooray, I've ovulated, and she applies the standard post-ovulation rules with no restrictions on intercourse. Now, this rule is specific to premenopause. In the menopause years, even if she has a true period, that is, there was a temperature rise before it in the previous cycle, so this is genuinely a period, they can't treat it as infertile, and after the period stops, they have to treat the last day of the bleeding as if it were a peak day, and they have to count 4 days of either dryness or the basic infertile pattern before beginning intercourse on the non-consecutive night rule. Now, the reason for this is that very early ovulations are common in the premenopause years, particularly following long cycles. I've seen lots of charts where a woman might have had a cycle for 50, 60 days, and then blow me, the next one was only 20 days, as if the body's trying to catch up on the days it lost in the last cycle. So the bleeding of the period can actually mask the start of fertile mucus leading into this very early ovulation. They can ovulate as early as day 9 or 10 in the cycle. Now, this has to be emphasized to the couples who were previously used to using the days straight after a period, regarding them as always to be infertile. So you have to explain why this is happening, because of this unpredictability in the premenopause and the sneaking in of these unexpectedly short cycles. So the post-period phase must now be treated with caution and a count of 4 days of BIP or dryness, whatever, before intercourse is resumed. Okay? Another specific rule for menopause, the early shedding rule. Now, this doesn't happen often, but I have had a few cases of it myself among my clients, so I know this rule well. These are the women who I say complain about, I'm bleeding all the time. Look what happens to them. They can have an ovulation and the spotting starts in the luteal phase. Now, if that's been confirmed by a temperature, this is one bleeding they can actually ignore because there was a temperature rise and it's now happening in the luteal phase. This bleeding cannot be fertile, so this can be ignored. But tell them to continue charting the temperature. Because what can happen is, in these cases, these women who have this very early shedding, very early, straight after ovulation in fact, the bleeding can become increasingly heavy nearer the period. And in the end, she may bleed for 5 days before the period actually sets in, and then continue bleeding, and then the bleeding stops. And what usually happens is the client rings you up and says, where do I count day 1 from? I've been bleeding heavily for about 11 days. And the answer is, if she's kept on with her temperature chart, that temperature will fall whenever the period is actually starting. So although the bleeding may be heavy for several days, the end of that luteal phase, which started with spotting after the ovulation, then went into a heavier bleed, but the temperature will fall. And then the bleeding, which is actually the next period setting in, that will be indicated by this fall in the temperature.